Hello everybody, my name is Jenny Daniels and
I'm Dr. Robert Daniels, Jenny's husband.
yeah, so obviously we are husband and wife.
Right.
So anyway, this is the continuation of the the first episode that we
The first presentation we did was on the dark side of coffee. Last time we talked about how coffee can be a general intestinal irritant, and there are many reasons for that. When you extract the organic compounds from coffee by pouring hot water through ground coffee, you're extracting all kinds of compounds that are irritating to the intestinal mucosa, acids, ketones, aldehydes, and some of them inhibit digestion. Other cause gastric emptying before the acids in your stomach have time to digest the food. So there's all kinds of reasons why coffee can be an intestinal irritant, and especially if you're a coffee addict and you drink large quantities of coffee over a long period of time, as I did, then you probably have symptoms associated with generalized GI irritation. Many of you will have a diagnosis of irritable bowel syndrome. So what I'm going to do in this lecture is just go over my clinical case, what happened over time symptomatically to me because I drank large quantities of coffee over a long period of time. And so I'll start with, when I first started drinking large amounts of coffee, and that's when I went back to school after I had worked as an assistant golf pro for a while. And, I wasn't a great golfer, and I wasn't a great assistant golf pro, and so I didn't see much future for myself, so I decided to go back to school. And my intention was to go to medical or dental school, and for that you have to have good grades. And I had to work 40 hours a week to support myself while I went to college. I probably could have taken out large student loans, I probably should have, but I decided to work. And most of the students I was competing against didn't have to work. And so academically I felt like I had to do something extraordinary. And what I decided to do was just stay up very late, till about 2 o'clock in the morning every day, to give myself enough time to try to keep up academically with my fellow students. And so I started drinking large quantities of coffee just to keep myself awake. And so I was drinking 4 or 5 cups of coffee a day during the time that I was going to college. I went to San Diego State. I majored in microbiology. And during that time, I work part-time, which again, I think I was one of only maybe 2 students that was actually working during dental school, kind of unusual. So again, I continued to drink a lot of coffee because...
So how many cups this time?
I probably was drinking a similar amount, 4 to 5 cups a day. And the coffee at Tufts was horrible. I would get up and I'd barely make it to class on time, so I'd drink, a cup of black coffee on an empty stomach, which is a very bad idea. But
he was very poor before.
Yes, I was, yeah. So anyway, I started to notice symptoms in dental school for the first time, significant symptoms. And the symptoms were a continuation of feeling more tired than I thought I should at that age, certainly. And I was also a runner. For the first time when I was out running, I would have episodes of urgency, gastrointestinal urgency. And a couple times I honestly didn't...
What does that mean to the Filipino that's watching?
Not in Filipino, but if they can understand English, it means that you have abdominal discomfort, and fairly severe discomfort, and you know that you have to go to the bathroom and you don't know if you can hold it, So a couple of times I really almost didn't make it home before having an accident. Obviously, you don't want to have an accident out on the public streets of Boston running, but yeah, that's the situation I was in. And then the third symptom I had was a little bit unusual, but in a future lecture I'll explain why it may not be that unusual for men. But I started to have symptoms of prostatitis, and that's pretty young. I was only about 27 when I was in dental school, and so pretty young to be having symptoms of prostatitis. And when I would go to a doctor, they wouldn't be able to they would not be able to discover an underlying cause. In other words, what we call an etiology. And anytime you go to a doctor and you have a significant symptom and they cannot tell you what's causing it, that's kind of a red flag that it probably is autoimmune, because there are infectious causes like bacteria and fungus, and there are sort of functional causes. You could have cancer or a cyst or a variety of things. A prostate could have a granuloma. If they do not have an etiology, really about the only alternative is an autoimmune inflammation. So I had those three symptoms, and they were starting to be noticeable. So I got through dental school, and I got accepted into a hospital residency. And in my hospital residency, I probably didn't drink as much coffee because I didn't have to stay up late studying to the degree that I did in dental school and in college. There was a little more freedom, and my symptoms didn't really progress that significantly. I certainly had symptoms, but they were very tolerable to me. And so I got through that residency. I got out and I went into private practice in one form or another for a couple of years. And during that time, again, my symptoms didn't seem to progress as much. And I wasn't drinking as much coffee. Again, didn't have to stay up late and study. And so, although I had the habit, I just wasn't drinking quite as much. So I would have periodic episodes of prostatitis symptomatically, which would always come back as non-bacterial prostatitis, meaning they couldn't find an etiology. And I would have, one symptom I didn't mention that I had when I was in my dental school is that I would have really serious episodes of rhinosinusitis, and rhinosinusitis that would not respond to treatment. And so I would have symptoms for months during the fall of the year in Boston. And so I would continue to have some sinus symptoms. And then again, I always felt like I was more fatigued than I should be. And I would have periodic episodes of gastroenteritis, which, most gastroenterologists would call irritable bowel syndrome. But in all of those cases, my doctors could not find an underlying etiology, and the treatments they would prescribe were usually unsuccessful. So I would go through the episodes and they would just pass on their own. So I would go through periods of remission with each episode or with each type of symptom. And so after a couple years in private practice, I went into the Air Force because I wanted to specialize, and the only way I could get specialty training was through the military. And so I went into the Air Force. I spent a total of 12 years initially in the active duty Air Force. During that time, my symptoms initially didn't progress that much. Again, I would have these periodic episodes of gastroenteritis, prostatitis, sinusitis, and fatigue. None of them could be traced to an etiology or a cause by the doctors that I saw.
So from 20 years old to this time that you are talking about. So what is the medicine that the doctor gave you, so if ever?
Well, they you know, there's the pharmaceutical industry has produced innumerable drugs to treat symptoms. And one of the problems that doctors have is that, you know, oftentimes when you see a doctor, you only see them for a few minutes. And, you know, the most common thing and the easiest thing for a doctor to do is recognize your symptoms, just like any lay person could recognize your symptoms, and prescribe a medicine that has been produced by the pharmacology industry to treat symptoms. And the thing about autoimmune disease is that the majority of the time, drugs to treat symptoms are not successful with autoimmune disease. And that, again, that should be a red flag for the doctor, but doctors get into routines and they find it difficult to alter their routines. And just statistically, they have done studies, and the studies show that 1 in every 5 people in America has an autoimmune disease. But yet, when you go to the doctor, I went to the doctor hundreds and hundreds of times. I saw dozens and dozens of doctors, and not a single one of them put in their differential an autoimmune disease. And yet, 1 in every 5 patients at least probably had an autoimmune disease, and maybe in terms of people that go to a doctor, maybe even that's higher, maybe it's 1 in 3. So, you know, to go to repeatedly to a doctor and have them not be successful treating you and never consider autoimmune disease as an alternative is pretty ridiculous when you think about it.
I think, excuse me, I think the reason I can see the difference really why American has what 1 every 5 person there's a
1 in every 5 people has autoimmune disease.
Because I noticed that even in my work, I noticed that they really drink a lot of soda and coffee without food. So, and you know, a good percentage of people that go to work stop at Starbucks on their way to work and get a large coffee of one form or another, and I did that too. So anyway, in my 12 years in the service, my symptoms continued to act up periodically, and I also started to have a few other symptoms associated with my joints and muscles. And so anyway, near the end of my 12 years of active duty, I finally got a specialty residency, and it was in periodontics. So I learned periodontal surgery and implant surgery in a residency that I did in New Orleans, Louisiana at LSU. At LSU, I started to have serious symptoms. And when I say serious, I mean I had really serious gastrointestinal urgency, the kind of thing where if you're not near a bathroom, you're gonna have an accident. And I also started to have worse symptoms of prostatitis and sinusitis and muscle and joint pain. And the other thing I developed was I had trouble lying for any length of time on my own skin. And that was due to a condition called pruritus, or just general itching. And again, I would go to doctors and they would not find any underlying cause. And so essentially the doctors were saying that the conditions, the symptoms were idiopathic, meaning that there's no known cause. And that is a big red light too. If you're going to doctors that constantly can't describe an etiology for your symptoms, you probably should look for a different doctor. And the other thing is that statistically, if you have unexplained symptoms of multiple organs. Like, I had gastrointestinal, urinary tract, skin, sinus, muscle, joint, and fatigue. There was no chance that I didn't have a systemic autoimmune disease, because it's impossible for all of those symptoms to be caused or have an independent cause. And of course, my doctors couldn't describe an underlying etiology for any of my symptoms. But yeah, that's a dead giveaway, that if you have unexplained symptoms in multiple organs, that it's almost 100% sure that it's caused by a systemic autoimmune disease. So I had these severe symptoms, and I probably shouldn't have been in a surgical residency, but I was already in it, and I was such a good student and so good at taking tests that I was getting through the program, and so I went ahead and finished it up. And I got assigned after that to Randolph Air Force Base, and as my first assignment as head of periodontal and implant surgery. And during that time, oddly enough, maybe because it wasn't as stressful as a residency, and maybe I wasn't drinking quite as much coffee, my symptoms didn't get worse. And at the end of that residency, my assignment at Randolph, I decided to get out of the service, which was probably a foolish thing to do, but I wanted to try private practice. And so I got out and I opened a practice. I stayed in practice for about 6 years in one form or another. And during that time, my symptoms started to progress again. And I had episodes, honestly, when I was so bad that despite the fact that I kind of took pride in not missing work, there were many times when I shouldn't have been in working on patients. And sometimes it was so bad that I would have to give myself a liter of IV D5W before my patients came in to sort of revive myself, because the previous night I had such horrible episodes of diarrhea that I was dehydrated and totally exhausted. And yet I would go to gastroenterologists and to urologists and to ENT doctors, and they would be able to do nothing for me. And they didn't seem to have a problem with that. And so I did that for 6 years, and then I decided to go back into the Air Force, and luckily they took me back in, and I was put as head of periodontology and implantology at Luke Air Force Base in Arizona. And for a while my symptoms seemed to be somewhat in remission, meaning I could functionally go into work every day, and seemed to do sort of okay. But then again, at that base, we had a community coffee pot, and I started drinking more coffee, and the next thing I know, my symptoms started to become debilitating. And I went to my doctor, who was head of internal medicine. My other doctor was the head of dermatology. And I went to my doctor, who was head of internal medicine. I said, I can't continue to work like this. We either have to find a diagnosis and a successful treatment, or I'm going to have to quit. And again, he had no answers for me. He was baffled by the whole thing, and I went into the dermatologist with some very pathognomonic symptoms, and he should have identified my underlying diseases, and he should have put me into treatment, but he didn't recognize that. And then at that time, I did not know the diseases myself. I'm a dentist, I'm not an MD. And I was very busy, had a very busy life, and I didn't have time to go through the endless hours of study it took to diagnose my diseases. So in the end, I resigned my commission in the Air Force. I got out. I had given up on the medical system, and I moved up to Los Alamos, which is a beautiful place up in the mountains, with my son, and started the project of trying to figure out what the diagnosis was. Because the one thing I can tell you about medicine is that without a diagnosis, without knowing what is causing your symptoms, you can't be successful for the most part at treating a patient. So I went up to Los Alamos, and my symptoms continued to get worse. I got to the point where I couldn't almost leave my house. Luckily, the grocery store was only 5 minutes away, and the city of Los Alamos was only about 15 minutes away. But even despite the fact that those places where I had to shop and do business were so close, I still had multiple accidents where I lost control of my bowels and was fecally incontinent. And in addition to being fecally incontinent and having 8 or 10 episodes a day of severe abdominal pain followed by explosive diarrhea, I also was urinary incontinent, and at times, unbelievably, I was totally obstructed. But when I would go to a urologist, my PSA was normal. I had no bacteria in my urine or my prostatic fluid, and my prostate didn't feel particularly abnormal when the urologist would palpate it. So once again, I was in this horrible situation of having these extreme, debilitating symptoms, and my doctor saying, yeah, I'm sorry, I can't help you because I don't know what's causing this. And at no time, again, from the time I started having symptoms, probably 15 or 20 years before, after seeing 40 or 50 doctors hundreds and hundreds of times, nobody has suggested autoimmune disease. So during my time at Los Alamos, it took me about 1.5 years, but in 1.5 years, I was able to make the diagnosis. And the thing about drinking large amounts of coffee over a long period of time, there are multiple consequences of your GI tract having generalized inflammation. The first consequence is that you'll develop leaky gut syndrome. And leaky gut syndrome just means that your gastrointestinal mucosa is more permeable and exposes your bloodstream and your immune system to proteins and antigens that you wouldn't be exposed to if your gastrointestinal mucosa were healthy. And so it sensitizes your immune system to proteins and antigens that your immune system would not be sensitized to if you had a healthy gastrointestinal mucosa. So that's the first consequence. And many times the first symptoms associated with that are esophageal reflux, esophagitis, gastritis, something that, gastroenterologists would call irritable bowel syndrome, and fatigue. So, you might have periodic episodes of abdominal pain followed by diarrhea. You might be more fatigued than you feel like you should be. And you go to a doctor and tell them that stuff, and they can't do anything about it because They don't know the diagnosis or the solution. And so if you, in my case, because I genetically have the potential to express a number of autoimmune diseases, you know, I have a more severe case than probably many people would, because coffee and leaky gut syndrome acted as a trigger to my autoimmune diseases, which I may not even have expressed if I never had leaky gut syndrome. And certainly if I had expressed it, it probably wouldn't be nearly as severe as my diseases ended up being. So in my final lecture, you know, I will cover the treatment that was successful in curing or causing a long-term remission of all of my symptoms. Because remember, I was fecally incontinent, I was urinary incontinent, I couldn't sleep on my own skin because of generalized pruritus. I had horrible, debilitating sinusitis with almost total obstruction. And I was horribly, horribly fatigued. And the treatment that I ultimately got cured or caused complete remission of all of those symptoms. But the process of getting that treatment was not simple.
I'm sorry.
So again, not all cases of people who are drinking large amounts of coffee over a long period of time are going to be as severe as mine. But the basic symptoms of esophagitis, esophageal reflux, unexplained fatigue, unexplained gastrointestinal symptoms, perhaps unexplained muscle and joint symptoms, and sinus symptoms.
So I remember now.
Maybe those cases can be resolved by discontinuing coffee and eating a very restricted, healthy diet. But for cases like mine, you need something much more powerful than that.
Excuse
because,
me.
just as I'm just going to finish this one thing, dear,
Okay.
is that once your immune system is highly sensitized, yeah, you can't reverse that just simply by not drinking coffee. It requires a concerted effort and a very specific kind of treatment to desensitize your immune system. And so, go ahead, dear. What were you
So
going to say?
because I remember, I don't want to forget, you know, I remember because I was working as a housekeeping in the hospital. So of the worker also there, when I was cleaning her room, she said that she knows, because she has tummy ache, she said that she knows that the coffee is not good for her tummy, but she cannot just stop drinking coffee. So that's it.
Okay.
Okay.
So I think we're done here for this presentation, and I look forward to talking to you in our third presentation, where I will give you the solution for at least cases like mine, as severe as mine, and maybe some other cases that, as I said, just discontinuing coffee once your immune system is highly sensitized is not going to do the trick. And one more little anecdote. I got so bad, my immune system was so sensitized that if I would chew a piece of gum, it would initiate a profound gastrointestinal reaction. And so, you know, your immune system can get to the point where it is so sensitized that anything you eat will cause a gastrointestinal reaction that is extremely unpleasant and painful.
Yeah, when he went to the Philippines, he said he is.
I think what I told you was about 50%, which was a lot, but
No, it's.
no, I think 50%.
Okay.
So and when I went to the Philippines, it was to get a particular type of treatment, which I did get, but it was too expensive to continue there.
Yeah, 1 million.
Yeah, and pesos. But the thing about it is that even though I was somewhat better from my previous treatment, we still could not go to the mall or other places without, 50% of the time telling her that we have to turn around and go back because I'm not going to make it there,
Don't think we have a
without
car
having
there.
an accident. Yeah, right. And so, yeah, even though I was somewhat better, I was still fecally incontinent, urinary incontinent, completely exhausted. And so, again, at our next series or lecture, I'll go over the final solution to getting better and living a normal life.
Yeah. So, please subscribe and like. Thank you for watching.
Yes.
Bye-bye.
Thank you.